bit of a change to our agenda. The reason that we started a half an hour early is to accommodate the schedule of Dr. P.J. Brennan, who's the Chief Medical Officer and Senior Vice President of the University of Pennsylvania Health System. He's board certified in infectious disease and internal medicine. He was with us previously, and we welcome him back. Dr. Brennan?
Thank you, Mr. Feinberg. So Dr. Rushi asked me to be here tonight, and I'll just make some brief remarks to kind of put a perspective on my current thinking, and then be happy to take questions. So my remarks will be brief. In every school, I think, across the county, in the township, and across the country has been preparing for reopening since the end of the last school year in June. We were in a different place in the pandemic in June than we are today. And I have to say that in my conversations and the many meetings, looking at data and talking about where we stood in the pandemic, I was much more optimistic. I'm not pessimistic necessarily now, but I was much more optimistic in June about where we would be in August than I am today. We're certainly in a better place than we were in March and April, so I don't want to create panic or suggest that things are in terrible shape. But we're not where we had hoped to be by this time in August. We've seen an uptick in cases in the past month across the region, in the city, in the county, and in the township. And the trajectory has been upwards during that time. It's not entirely clear why, but it seems to have begun its upward trajectory just after the 4th of July holiday, so it may have been related to socializing, being out, and engaging in holiday activities. But what we really want to know is where we're going to be when school reopens, and to what degree we could feel assurance that conditions are going to be safe to reopen. So that is something that is not knowable. We have models, and the models suggest that the trajectory will continue to go up, not as sharply as it did in March and April, but that we will have more community transmission and more positive cases over the next few weeks. The test positivity in Delaware County at this point in time is about 6.5%, according to data from the Chester County Health Department. In the data that I've tracked from the Chester County Health Department from Haverford Township, in the last 30 days, there have been 140 new cases in the township. And about 60%, or maybe even 2/3 of those, have occurred over the last week or 10 days. They've at least been reported over the last week or 10 days. So there's always some uncertainty about exactly when they occurred. But if you look at it over the last month, there are 140 new cases, roughly 5 a day, between 4 and 5 new cases a day. And if you go back to the beginning of July and look back 30 days, there were roughly 20 new cases over those 30 days. So there was fewer than 1 new case, and now nearly 5 new cases, and more than that in the last week or so. So, given the uncertainty, given the runway that schools need to reopen, and the trajectory that we're seeing, my recommendation to the superintendents, Dr. Rushi and others, has been to go virtual to start the fall semester and follow the data closely and see where we are after Labor Day, and make decisions at that point with data in hand that looks at the test positivity rate, the accumulation of new cases, the 7-day rolling average of cases, what's happening in the hospitals, and what's happening with mortality, and who's getting sick. In the most recent few weeks, as part of the epidemic, the cases that we're seeing in the community are tending to be younger cases. Hospitalizations still seem to be older individuals who are at greater risk. and that younger population is not as prone to severe complications and fatalities. So that's a good thing. But it does pose the hazard of further spread in the community, as does, I think, the reopening of school. And we've seen that around the country as schools have reopened and have had to quickly close. We're in a range where I think we could expect to see transmission, and I would expect to see cases in school. We're in a position now where we're still trying to mitigate the epidemic, more so than trying to contain it and eradicate it at this point in time. And this is in a region of the country that has done better than most others, but really southeastern Pennsylvania, for as hard as we were hit, we were not hit as hard as many areas, but for as hard as we were hit, we shut down relatively quickly schools and businesses and stay at home. And even so, when we began to move through the phases of reopening from red to yellow to green, we did see an uptick in cases, and places that did it prematurely had a more severe uptick in cases. So my recommendation has been to go virtual to start the school year, pay close attention to the numbers, and then try to resume in-person education, adhering to the things that have gotten us to where we are, have brought us from very high test positivity rates and incidence of disease through masking and social distancing and screening and cohorting, and use all those practices when we are able to reopen safely. So, Mr. Feinberg, those are my comments and my rationale for the recommendations that I've made, and I'll be happy to take questions.
Thank you very much. Questions from the board? Bridget.
Hi, thank you for your comments. I've also looked at the Chester County data website and probably not in much detail as you have. Can you tell us and the public what parts of that data we should be following or tracking? And also, do you have a recommendation? I heard at least one statistic in your presentation about a positivity rate above 6%. Is there a metric of a positivity rate or other indicators that would be an indication of safe to resume some in-person schooling with the layers of mitigants that we had included in the health and safety plan?
Yeah, let me address the last part of your question first. I've recently discussed thresholds for reopening and reclosing with CDC staff, Centers for Disease Control and Prevention staff, who are working on community guidance. And there are no firm thresholds for reopening or reclosing should you reopen and start to have cases again. That's something that CDC is working on, and we're all trying to figure out. At this point in time, I think that the numbers can box you in to say that 3% is a safe level for athletics, for example, or 5% is a safe, below 5% is a safe level to reopen, or above 9% is a. Those are the kind of numbers that have been thrown around. I think my view is that they're somewhat arbitrary. We're having this conversation because to me, all of those are in a gray zone. If the case positivity rate was 1% or 30%, it would be a no-brainer. It would be clear that we either needed to open up or close down. So to me, there are a number of factors that we should be looking at, including the test positivity rate, the numbers of new cases that are accumulating, and the rolling averages, the 7-day and 14-day rolling averages. And those are not on the Chester County website, but I believe that they're going to be posting that sort of information soon. So it's going to take, I believe, careful follow-up on the numbers and follow-up on the trajectory. And right now, the trajectory, as I see it, is not going down. It's not headed up as sharply as it was in March and April, but it is headed upwards, and the projections are that it will go higher still. And I'll just say something about the projections. Models are oftentimes wrong, and they have to be adjusted regularly, but that's what we have. We have current data, and we have models projecting where we're going to be in a few weeks, and there are looming deadlines. And I think when you put all that together, to me, the prudent approach is to postpone, buy time as much as you can, to have a clearer sense of where this is going. Did I cover everything that you asked?
Yes, thank you.
Sure.
Antoinette?
I actually need a minute. Can you have Laura go before me?
Sure. Laura, you want to jump in?
Hi, yes, thank you. I wanted to follow up on that. I know that there has been some discussion in the past about underreporting of the current numbers because a lot of people aren't going to get tested for whatever reason. Do you think that that's still a concern and that these numbers could actually be underreported, or do you think that they're fairly accurate?
I don't think our numbers anywhere across the country accurately reflect the extent of disease in the population. So for example, when New York City, and I just use this as an example, when New York City had the most intense period of its outbreak in the March-April timeframe, about 6% of the population seemed to be testing positive. But in the aftermath of that, when serum studies were done to detect antibodies, as many as 20% of people randomly selected. It wasn't a totally random population, but as many as 20% of people had antibodies, indicating that they had been infected, whereas only 6 or 7 or maybe 10% were showing up that way. There are estimates from CDC that we may be undercounting cases by anywhere from 6 to 10-fold. So right now, Haverford Township has an incidence in the population of just over 1%. The real incidence may be 6% or it may be as high as 10%. But whatever that number is, I think it has been influenced by the limitations on our testing. We do have more tests available to us today, but it's not nearly enough for what this country needs. And you can see that because of the long turnaround times on the tests. Testing is not just the swabs and the test tubes that are needed and the medium in which the materials are transported, but it's also the devices and the staffing to do these tests. And we don't have that all of that goes into the testing capacity, and we don't have it in sufficient numbers. So you get tests back, 8, 10, 14 days, and they're useless because somebody has been out and about and, spreading infection. So I do think these are underrepresented numbers.
Thank you.
Antoinette, you ready?
Yeah, thanks. So I think the first thing that I would point out is, we talk a lot about these numbers, and if you go to the Chester County website, the numbers for children are very low. And so I guess I just wanted to ask you about your recommendations, specifically why you would still recommend virtual for example, our elementary students, who we all know are the most harmed by, being in a virtual atmosphere. And the data shows, at least in Delaware County, 6 children, 9 and under, have tested positive for coronavirus. But as I understand it, I think it's still your recommendation that we do bring the school year in as virtual for even those elementary school students.
That's a really good question. I think those numbers are still underrepresented, but even if you multiply by 6-fold or 10-fold, you're talking about 30 to 60 children under the age of 10. Today is day 224 since we found out about this virus. China announced that the outbreak was occurring in Hunan on December 31st. That was 224 days ago. And it's really remarkable what we have learned in that time and where we are. I mean, we're starting vaccine trials. We have one drug that has some benefit. We have diagnostic tests. But there's a great deal that we still don't know about transmission, and we're learning more and more all the time. So I would not dispute that children are less severely affected. But children do become infected. And there is evidence that children even shed more virus than adults. So, there are ways to stratify this. When you look at the next age group up, you cited 0 to 10, but 10 or 0 to 9, 10 to 19 has about 450 individuals in it. And there's no breakdown that I'm aware of on a year-by-year basis, but I would expect that that's on a sliding scale, so that as you get closer to young adulthood, from 10-year-olds and early adolescents, you're going to see more symptomatic cases, again underrepresented by our lack of testing. But I think out of an abundance of caution at this point in time, with the recognition that children do become infected, can be harmed, although they rarely die, and do have sequelae of infection related to inflammatory processes, that for now I would recommend that they be part of the virtual learning, not forever, but in a measured way. Continue this until we have greater certainty about the trajectory of the pandemic locally.
And then I guess a follow-up to that would be, if our numbers don't get better, if these stay the same, but again, we're not seeing any increase in that age group, would it ever become your recommendation to bring back just those elementary school students? Or would it be, this is just a level of transmission that in the community that's just unacceptable for any level?
Yeah, I think I'll be cautious about that, but I would say, you asked, would it ever be my recommendation? Yes, I think it could be.
Thank you. Another question I had was, so what's being presented to us tonight is to go virtual for just the month of September, and then, to reevaluate and hopefully numbers go down and we bring folks back in October. But I know, and it might have been earlier in the virus outbreak, but people were very concerned about the fall. And so, I think that there were a lot of organizations and experts saying that they were concerned that there will be another spike in the fall, and either because folks move more indoors, or because of potential comorbidities with the flu. And so my question then is, if we put off having any in-person for the entire month of September and hope we can go back in October, are we then going to run up against these other issues at that time?
Yeah, well, at some point we'll run into the flu season. And the flu season can start anywhere from October to February generally. It's usually across the country, it's usually about 6 months long. It doesn't often start here as early as October. It's usually more in the December, January timeframe. I'm anticipating that by the end of August, you're going to have a better handle on what the trajectory of this is. And my concern in a temporal sense is what's going to happen just before you come back to school. Lots of families take vacations at the shore. Are we going to see another mini surge in the immediate aftermath of the Labor Day holiday? So I think getting past Labor Day and into September will give you a better handle on that. There's no evidence to date that this is a seasonal virus. There is evidence to date to suggest that whenever we open up, we're going to see more cases, even among the places that have done best. Even Pittsburgh, Allegheny County, which had very few cases, and really felt like they had managed it very well, just exploded in over the last month or so. and they're now beginning to bring it down again. So I'd like to see us in a better place in terms of the metrics that we're going to follow and get down to very low rates in the community before we reopen. And I think that's potentially possible by the end of September.
Mm-hmm. I
And
guess.
Annette, if I could interrupt you, Dr. Brennan's on a short time frame, so I'd like to give Ari and Dave each a chance to ask a question or two. If we have
Okay.
time, we'll come back around, all right?
Okay, I understand. Thank you, Dr. Brennan.
Sure.
Ari, you there? Yeah, go ahead.
Hi, Dr. Brennan. Nice to see you
Hi.
again.
Good to see you.
I'm surprised that you're back, and thank you for coming back
Sure.
to our what has now become weekly board meetings.
Mm-hmm. I can imagine.
So if I could just, for the lay term people like myself, summarize, it sounds like even though the numbers are better than they were, they're going in a direction where a month of virtual is a good idea at this point in time. And
That's right.
you know, obviously case counts, you can say they're up, but they're also testing more. I know we're not at the numbers we should be for the first world country that we are. I don't want to digress.
Yep. Yeah.
So even though case counts are up, a percentage of testing, isn't it possible that that number is actually, as a percentage of testing, down?
Well, what you would hope to see with more testing is that the test positivity rate goes down, because as you test more, you have a larger numerator. But if you're finding more cases in excess of how you're testing, then your positivity is going up. So it certainly contributes some to to finding additional cases. But my view is that the test positivity is being driven by more transmission. And I think
Right.
the evidence that we see for that, for what's driving more transmission is that social distancing practices are deteriorating as we get further into this. We were doing much better with things like non-essential travel, going to non-essential businesses, masking, and even social distancing. I think So I'll pause there so you can finish your question.
Yeah, one more question so we can get Dave in. Is it too simplistic of a view for any one district to look at their own numbers within their own township when people work in other townships, people travel to other townships, other states, so on and so forth? I would really love to be able, and sorry for labeling it as such, but the ambiguity of what we need to see, what we need to record in Haverford Township or in southeastern Pennsylvania to get us to where we can open. It is important for this community and any community for that point to get their children back in school. Yeah. We've heard from a lot of people who are on both sides of this issue. They want to go back and they want to go virtual. But in a month's time, in the month's time it will take us to get to that point in time where we're going to reconsider a hybrid model, if I may. It'd be really helpful to be less ambiguous, to have a better sort of idea of what really needs to happen other than case counts, however you want to define it, going in the direction you want it to go, whether it's a percentage or a number. Sorry to put you on the spot, and you don't need to answer that for now, because we can always come back to it at some point in a couple of weeks or in September.
Yeah, I think you're really asking the question at the heart of the matter. What is the threshold for coming back? And I think it's going to be an accumulation of evidence that everything is headed in the right direction. Regarding the issue of discrete townships and municipalities, I cite Haverford Township data just as a matter of relevance to this audience. Those numbers are even more dramatic for Upper Darby, and they're going up I don't pay close attention to most of the townships in the Chester County website, but I can tell you that of those that I'm following, they're going up. So the trend is seen everywhere, and I don't think that discrete township boundaries matter that much. I think about this actually on a regional basis.
Well, I really appreciate your help and your participation, because I think it's a really difficult position that school boards and superintendents are being forced into making these decisions around public health and infectious disease. And it's just not what we're trained or working in day to day.
Well, where I hope to be in the next few weeks, and I don't know for certain that we can be, but where I hope to be is to have enough information that we can say this is a threshold. These are the threshold issues, the boundaries on either side, so that we can give more discrete guidance to you. I don't envy the position that any of the superintendents or the boards are in this county.
Maybe Larry can deputize you before the next meeting.
Okay.
Dave, you up?
Yes, thank you, Dr. Brennan, for coming back. We do appreciate it. I know you're on a tight timeline here, so I'll just ask one question, try to be quick. We'll know more tomorrow when PIAA makes an announcement. I'm just curious if you have any thoughts about fall sports.
Yes, I think that fall sports are going to be very difficult to play. I work at Penn. The Ivy League has canceled all fall sports. There's going to be individual skills training and weight training in small groups. As much as possible will be done outdoors. I think that the sports that are going to be most challenging are the contact sports. I would add to that another challenging aspect of that is the teaming that occurs. Baseball teams, I think, are pretty safe when they're out on the field. They're not very close to each other. They're out in the sunshine. There's great ventilation, but then they go and sit in the dugout, or they ride in a bus, or they just congregate as they're, in Little League or high school ball as they're going to and from the game. So I think that's as much of an issue as the actual team activities. But lacrosse, soccer, basketball, football, not all of those are fall sports, but I think they're going to be pretty challenging given the proximity just in the ordinary play of the game that players will have to each other. So I think, for the fall, individual skills development and conditioning are probably the wisest route to go.
What?
Time for one more, Dr. Brennan?
Sure, yeah.
Kristen?
Hi, Dr. Brennan. I just wanted to ask, we've been talking a lot about numbers and percentages, and I think it's really important to put this into perspective that we're talking about people and to humanize these numbers. I'm just wondering, from your work on the ground and your conversations with colleagues, what would you say to the community in terms of these numbers? Maybe people who are saying, oh, I don't know anyone who had this, or, these numbers aren't accurate, and they're really just not believing the data. How can we humanize this information for people?
Yeah, first I would say the numbers are not accurate. They're underestimates. And there are more people than we know. 1% of the population being infected in Haverford Township is not very many. But, what really has humanized this for me is to see the disparities in disease that have occurred across demographic groups in the course of this pandemic. So, those of us who have the ability to work remotely because of the nature of the work that we can do are able to socially distance in a better way, to avoid crowds and avoid infection. And those who are paradoxically essential workers are having to travel on public transportation and be in crowded spaces and do the kind of work that brings them into exposure with asymptomatic people and has led to lots and lots of death. And, you know, it's really heartbreaking the way that we have had to manage that. You asked me to humanize it. The way that we've had to manage this in the hospital, with visitors not being permitted, people dying on ventilators with loved ones standing outside their rooms, watching them through the glass in intensive care units. And you know, this is real. There's no question about this. You know, 160,000 people have died in the United States, and nearly 5 million have been infected. So, you know, this is the worst infectious diseases catastrophe of all of our lifetimes. There have been other pandemics in our lifetimes, but nothing like this. And it's going to continue to be with us for some time. And I think we have to be very serious about driving the rates down as low as possible and making the world safer for all of us until such time as we have a reliable and safe vaccine, which I hope will be sometime next year.
Thank you.
Any other questions from the board? Dr. Brennan, thank you very much for your time. We really appreciate the time you spend with us, and also with our superintendents in the county and at the DCIU. And unfortunately, I have a feeling that we're going to see you again. So.
Okay. Well, it's my pleasure. Thank you for having me.
Thank you,
Good luck.
Dr.
Thank you. Bye.